My name is Angela. I head the laboratories at Ilara Health. My background is research. I did mainly biochemistry and biophysics in the past. I used to work at the Dutch National Blood Bank, and then I moved to Kenya to work with Ilara 2 years ago, when we started actually implementing the projects we wanted to start with.
What kind of projects are you working on currently?
Yeah, so the core of Ilara Health is based on point-of-care devices to reach out to communities in geographical areas that are harder to reach for getting proper diagnostic devices. So our core is there, bringing diagnostic tools to communities that actually didn't have access to before. We do this through point-of-care devices, as I just said, and through decentralized laboratory services in such a way that we can cater for the laboratory tests that cannot be done on a point-of-care basis through our laboratories.
So what kind of facilities are you working with? Large hospitals, small one, medium?
That really depends. So normally we focus on smaller primary healthcare facilities. But we also partner with level 3 and for hospitals for higher and more specialized laboratory services.
Okay, by Ilara Health going into this space, there must have been a gap. But how huge is the gap for testing?
Yeah, so we know already that the lack of diagnostics is actually affecting the outcome of the patient greatly, and especially we saw a big gap in sub-Saharan Africa and in Kenya to start with, especially if you think about the patients that don't even know that have diabetes or any other chronic disease. The numbers are dramatic. So this is the gap that we saw, and this is what we're trying to focus on: chronic diseases. And we're moving towards cancer awareness, cancer screening, so that we can bring all this type of diagnostics closer to the people and very affordably.
Access to the right technology, or technology that you can afford, is one of the toughest challenges in this sector.
Yeah.
Is there a way Ilara Health tries to bridge that gap? Cost, again, probably financing. Sometimes you have a good hospital, but you don't have the money by the equipment.
Absolutely so, Francis. So we try to bridge that gap from the diagnostics perspective using tech-powered devices that are actually able to use less reagents or less energy or be very efficient. We also have financial services for our clinics that we partner with in such a way that we can support them when they're setting up their facilities or if they want to improve their facilities. We offer them the tech platform they can use. We offer them the financial platform they can take advantage of in such a way that we look at the primary healthcare sector from an holistic point of view. We don't want, so diagnostics is just the beginning. So we want to try to holistically solve part of and close a little bit the gap that is between us now and universal access to healthcare.
As head of labs for Ilara Health, maybe the last point is maybe to talk about into the future.
Mm-hmm.
What kind of an infrastructure are you laying out for your diagnostic labs? And it's really the future for your company. I know we talked about Kenya, but is there an opportunity to go beyond?
Yeah, absolutely. So we are already working with strategic partners in other countries, in different parts of Africa. And the idea is that to reproduce the laboratory model that we are deploying at the moment within Kenya, and making sure that the needs of each specific country are actually catered for. About labs, I can say that we're working towards creating a bigger network through also telemedicine platforms that we're collaborating with. We want to connect, we want to close the gap between access to the clinician and access to the diagnostics. So we're trying to collaborate and have very fruitful collaborations with a few partners in the world of the telemedicine, so that we can actually go even further with delivering care to our patients.